Tennessee for Larry Elder.
Hi, good morning, Mr. Elder. How are you?
Good morning.
Yeah, I just wanted to ask you about Medicare. I think you said that Medicare was a bomb that was dropped on the medical system. I just tend to disagree because I have a elderly aunt. She's since passed, and I also have an uncle, her brother. And if it wasn't for Medicare, their medical bills would have been really out of sight. So I just wanted to get your opinion on that. My aunt was, very ill in the last few years of her life, and we had to take her back and forth to hospitals. And same with my uncle; he's still living, but he's had some illnesses crop up the last couple of years.
Right.
So I just wanted to ask you, what's your opinion on that? Because, like I say, if it wasn't for Medicare, they really would have been, their medical bills would have been very, very high.
Sure, I understand, and I'm not saying that Medicare has not provided benefits for people, but when you're robbing Peter to pay Paul, you can always count on the support of Paul. The question is, has Medicare made our our medical system, our healthcare system, less efficient? The answer is yes. Has it made it more expensive? The answer is yes. When you look at the typical stay in a hospital, the 2 decades before 1965, when the Medicare Act was passed, the typical one-day stay in a hospital increased threefold. You look at the 2 decades after, the typical one-day stay in a hospital increased eightfold. And I would say to you, if the government had not been taking so much of your family's money over so many years, you would have had enough money to pay for your own medical insurance. So no, I don't think just because certain people benefit, that justifies the entire system.